Alors nourri de ces regards un peu de Napo qui ont peut-être rappelé certaines situations à certains et qui en tous les cas rappellent les...
Thanks to Napo, and I'm sure that you could, all of you, reminisce about these very nice moments you had when teleworking. Now, send in your questions, and I'll make sure to pass them on to our speakers. Now, let's turn to our speakers and see how the EU framework can help us to cope with this various health environments and work environments, and what sort of prevention actions can be undertaken. We have Jesùs Alvarez Hidalgo, who's a doctor, medical doctor. He's a policy officer for the Health and Safety at Work Unit, Directorate-General for Employment, Social Affairs and Inclusion. So you'll share with us what the Strategy 2127 of the EU will do in this regard. And also with us today, William Cockburn, who's the Interim Executive Director for the European Agency for Safety and Health at Work, EU-OSHA. And NAPO was born in Bilbao. You tell us how this agency can help workers and companies alike to adapt themselves and anticipate and preempt the many transformations that we are faced with. Now, let me start with you, Jesùs. We've talked about the mobile workers, teleworking, automation, robotics, and so on and so forth. How, in your view, did the pandemic upset our vision of health and safety and the work environment? Yes, of course, with the pandemic, the world has changed, and of course, health and safety at work has also changed with it. I'd say that we've all come to realize that this is something which is very important. We all knew, but now I think that everyone, including our fellow citizens who are not experts in the field of prevention, are now aware that health and safety at work is very important, not only for health and safety in the workplace, but also for society at large. We've seen that during the pandemic with the first-line workers, the first-line employees, not only the healthcare providers, but also the civil servants, the people involved in retailing, distribution. So it's very important to protect each and every one. And during a major critical crisis, we can see that health and safety at work, HSS, is really something that can help us to tackle the risks and the hazards. And in this regard, it would be good to have a better coordination between public health and health and safety at work. We could see also that the pandemic was a catalyst, not only with regard to mental health. We have been told about the digitization, artificial intelligence, innovations, but irrespective of the technology that is used, the human factor is absolutely critical and at the forefront. And during the pandemic, we came to realize how much we do depend on each other. I'd say also that it's important to have a good preparedness, because we know that sooner or later we're going to be faced with yet another major crisis. This is why it's important to invest resources on training and have a better coordination to be better prepared in the future. Now, we had the opportunity to learn about all this firsthand during this crisis. Thank you very much.
We did a lot of tools, materials to support companies, employers and employees. You did these NAPO videos, you did a lot of guidance online with a lot of download in order to help distance work, digital work. You did also a refund of the EURA risk assessment tool in order for it to be effective on the COVID management in companies and small companies. It was very popular in France, actually. What surprised you the most in the demand, the expectation of the employers facing this tremendous new pandemic and change of work at this time?
Well, the development of this sort of material is really part of our DNA at EU-OSHA. I mean, on the one hand, we provide information, more research to support policy making, but the other part of our role, which is equally important, is to raise awareness about occupational safety and health and also provide examples of tools and guidance. And as you saw, NAPO is one of those tools that we prepare. And very quickly after the pandemic started, EU-OSHA collaborated with the unions, the employers and the governments in Europe to develop guidance on combating the risks from COVID-19. And quickly after that initial guidance, also looking at how the first wave was beginning to pass on reopening workplaces, because in the initial wave, the first reaction in many cases was to cut back on work, to send workers to work from home if that was possible. Many of the concerns were about reducing the risk of infection in the workplace, particularly where it wasn't possible to work remotely. Measures such as, for example, increasing the distance between workers, putting barriers in place, reducing the number of people in place at any one time through shift work, different organizational measures. Always, as we've heard from previous speakers, looking at the collective approach before individual protective measures. And one first surprise, I think, was how quickly the occupational safety and health community came together to react. We were able to put across our guidelines in a matter of days. In the follow-up guidelines looking at return to the workplace, we gathered examples from across Europe and beyond of sector and occupation-specific guidance in relation to COVID countermeasures. And within a matter of weeks, we had more than 700 examples, many from France, many produced by the ministry here in France for different trades and occupations. So that was the first pleasant surprise, if you like. The second was, as you say, the level of demand. Really, we had an unprecedented number of downloads of our guidance. I think we had around 1 million visits to the article online about the guidance. So really a great demand. The challenges that the enterprises were facing, I think, were on the one hand, how to adapt the workplaces quickly. We've heard a lot about how to adapt to remote working. But one important adaptation was how to deal with absences, because from one day to the next, many enterprises had substantial proportions of their staff absent on sick leave or simply isolating or looking after a member of family, and they had care responsibilities. In fact, these absences, we still see the impact today. I think just yesterday in the news, a couple of well-known airlines were announcing the cancellation of hundreds of flights because of staff who were away, absent, sick because of COVID. So I think those are perhaps the main issues that I take away from that experience.
Il y a ce qu'a été cette période-là, puis il y a la manière dont on va anticiper un peu ce qui va arriver, ce monde.
So this is, of course, what happened during this time of the pandemic. But now, of course, there's also the future with the hybrid company, and also the right to disconnection, also being accompanied in order to prevent a number of psychosocial risks, and also what sort of accident coverage, insurance coverage there could be for people working from home and who suffer an accident. So there's some call for an appeal for regulation. Of course, there's collective bargaining, but as we were saying towards the end of the morning session, there are also some EU regulations regulation maybe that could be put in place with regard to the right to disconnection. Of course, this may raise further problems because it's always difficult to know how to enforce them once you've put them in place, once they come into force. How can you check that indeed in the workplace at home this can be complied with? So how do you exchange on these? What sort of discussions do you have with your colleagues in Brussels about this sort of additional complementary measures to accompany teleworking? Do you think there's a directive that would be needed on the right to disconnection to better control all this? Well, as you well know, all this is already being considered at European level. I don't want to repeat any of the arguments or too many of the arguments already put forward during the former sessions. We've been told that we are learning from experience and that there are already some move forward, legal move forward in Italy, in Spain, in Portugal, or even in some Nordic countries. So one can see that depending on the member state, things are tackled differently depending on their culture, on their tradition, on how the industrial dialogue is implemented. The legal aspect is something which is very important. However, that there's a lot that is done at European level in favor of social dialogue, and you could see that people are more or less on the same wavelength. Generally speaking, the employees associations are in favor of the right to disconnection, however, the employers have a different take on this, which is absolutely legitimate, of course. We are currently reviewing all these aspects very closely. The legislation changes very quickly. However, you want the law to be sustainable. You don't want to change the rule every 2 years. Now, the right to disconnection was already debated upon, and the European Parliament adopted a resolution in this regard. Firstly, the European Parliament say that being permanently online and connected is something which can be dangerous, and this is reflected in the health and safety at work promoted by the Union. And they also invite each and everyone to think this over. And also, we would like, and the European Parliament ask the Commission to come forward with some legislative proposal. Now we are in the review phase. We've started very thorough study to look at risks and opportunities. We're also working with the information provided by the Bilbao agency, by EU-OSHA. A very ambitious study is going to be completed by the end of the year. And we're also working with the social partners who are, of course, have a vested interest in all that. Now, legislation is one possibility, but it's not the only one. There are many other things that could be done without a new piece of legislation. We've seen that also in other member states. So this is something which the door is open, I'd say.
The Bilbao and on the prevention aspect, how do you view the fact that there might be a directive on the right to disconnect to help to change the habits and to protect more the workers? Can it be a good news? Shall it be a silver bullet, if I could say?
Silver bullet? No, I'm sure. I think that what we have seen from our research on management of occupational safety and health, and particularly perhaps of psychosocial risks in enterprises, is that the main motivator is to comply with the expectations of society, to comply with the legislation, and in some cases also fear of sanctions from perhaps the Labour Inspectorate. But on its own, that's not enough. And these obligations need to be clear to the enterprises. They also need to be supported in terms of the guidance and the tools and the different methods for complying that I was mentioning earlier. And there needs to be awareness raising. Not all workplaces are in the same situation. I think the current context requires, or has required, something of a paradigm shift with the move to large-scale remote working. Suddenly you're evaluating the risks in an environment that is not directly under your control. As we heard from panelists earlier, the obligation from the framework directive is still there. You still have to evaluate the risks, but now you're doing it in somebody's home. And so how do you do that? Well, at EU-OSHA, we've been disseminating happily. This week is our week of priority area on telework in our campaign on musculoskeletal disorders, and we have nearly 150 different support tools for enterprises looking for help in carrying out.
So how is it possible concretely to do risk assessment at home, actually? Some people said you have to move the camera, so to say, here I did that, and you're a bit like an Apple, actually. How can you do the risk assessment when you're not concretely present, and when you cannot come to control afterwards if it's well done?
For sure, as an employer, I mean, you're relying on the cooperation of your employees, which is the same in any other situation as well. There are questionnaires that you can send for auto completion. Even
though questionnaire is just a questionnaire, people answers what they want to answer, what they can answer. It doesn't really necessarily fit with the reality.
It is, but we're seeing here a questionnaire about an issue that should be of common interest. Tell me about the light levels in your home office. Tell me whether you have an adjustable chair. Tell me whether your desk is adequate. And depending on the responses to those surveys, then of course the obligation is to put in place an action plan, and that may be to support employees in the purchase of ergonomic equipment to avoid musculoskeletal disorders. We've heard a lot also about the organizational aspects, and so such checklists or questionnaires, they also need to look at the workload, the working hours, senses of isolation, these aspects as well. And of course, that is also going to need to be followed up in an action plan. And there we heard about the challenges on managers, and managers are going to have to take an important role here in ensuring that these aspects are managed in a way that weren't done so before, a new approach. You can't rely on the day-to-day contact because people may not be calling in when they have a problem. You have to proactively seek out that information. What we're promoting is that there are tools to help you seek out proactively that information so that then you can develop the action plan and take action on it.
Relaying what we said with the person from Orange, like helping to have a real communication and create new rituals.
Absolutely. I think our message is that is not going to happen spontaneously. You need a framework, you need tools, you need action. You can't sit back and expect your employees to come to you and tell them what problems they have. You have to be more proactive. Whether legislation is, well, as I said, it's not the silver bullet, but it plays part of the mix. The obligations need to be clear. The employers need to be aware, and they need to also have the support and the tools in place to be able to take effective action.
Un dernier point, et Dieu sait ce qui est important, c'est le troisième point, troisième grande priorité de la stratégie européenne 21-27, il y a faire des...
A third priority, which is the third pillar in the 2021-2027 program, to have a safer working environment, and also the one that covers the DG UV from Germany, that is mitigating the level of risks, for instance, for cancer-inducing aspects. And there's a third aspect, which is that the objective is that we want companies to be ready for the next crisis. Now that we've said that, okay, It's all very nice to say that companies know how to anticipate. That's really ambitious. But practically speaking, how does that work? And what do you expect from companies? That is, how can they better anticipate in the years to come? Thank you for asking. Well, it's part of your strategy. That's not really a question I'm asking you. Okay, but the way you've described the context is really proper. As far as preparedness and anticipation is concerned, I think we can all do better. I think we can all improve and build capacity. I think you've asked the question for the employees. And what's for sure is that the employer's role is not easy. The law's quite demanding. The EU strategic framework requires a lot of things. And we've to realize that we, the Commission, have to be very careful about the micro companies, the very small companies that have 3 or 4 workers or employees. I wouldn't say that there are more risks, but the context is more complicated. First and foremost, they have to survive in a very competitive environment, which is really tough, and transitioning towards ecology and digital. And these very small companies have a tough life. Health and safety, let's face it, is not their #1 priority. So what should we do? Well, we should support them. We should help them. We should aid them. As William was saying, we have to provide them with tools. The Bilbao agency is doing an incredible work, and we have to be very practical. We have to know what they really need. What do they truly need? They need practical support about the tools. Well, we know the prevention pyramid, and it starts with risk evaluation. If you don't know what the risks are, you can't mitigate them. You can't fight against these risks. Here again, I'm saying that the agency is doing a good job with the risk assessment tools and what they did during the pandemic as well. And I suppose that maybe that means that we have to focus more on health risks and environmental risks. That is, we have to anticipate risks that do not just hover on companies. Correct. That means broadening the scope to cover the environment and to have a good view on the general backdrop. And therefore, that means we have to focus on the most vulnerable industries or sectors. There are labor forces that are more vulnerable, like seasonal workers. We saw that during the pandemic. The immigrants as well, for social reasons, for language reasons. And, well, we're doing very practical things. The EC has worked with the agency. We have a practical guidebook for the seasonal workers, for instance. And at the same time, as you said, we have to be ready for the future, for this crisis that will come sooner or later. In the recent weeks, we've seen, in addition to that, what's happened in Europe, which means we're faced with new challenges, hitting companies, hitting the price of commodities and raw materials in companies. So, this being said, we must be very proactive. And also what we need is to better coordinate these mechanisms that exist during the crisis between public health and vocational health. In some countries it works rather well, in others it doesn't really work well, and we need to come up with a European strategy, and we encourage the member states. We're working at EU level, of course, but what we encourage member states to do is to better work on the linkages for better coordination and a holistic approach. Okay, we don't have much time, but we have questions on the internet. What about long COVID? What does the EC say about this? Well, the European Commission has a European strategy which has found a trade-off in favor of recognition of COVID-19 as a vocational disease. We are analyzing this in the tri-party advisory committee. We hope we'll strike an agreement, and we hope that this will be included on the EU vocational disease list. It is not binding, but we promote harnessing and harmonization. So it'll have to be recognized.
Because this is going to be a new disease for people working. They get tired, then they get better, then they get worse. We don't have any vision about how the disease is going to evaluate.
That's right. The situation is evolving quite quickly. At the moment, the latest data, I think, suggests that as many as 1 in 20 persons who have suffered a serious COVID illness then still have persistent symptoms 4, 5, and more months afterwards. And it's quite challenging because these symptoms can be varied and varied over time and varied between people, fatigue, brain fog, and so on. That doesn't mean that many of these workers cannot work, but the work needs to be adapted. So we've published 2 guidance documents, one aimed at employers and one aimed at workers, both giving them some key tips on how to facilitate an effective return to work, which is also a major success factor in a good outcome for the illness itself. To be able to be leading a normal life, to be able to be contributing to work is an essential success factor also.
Dernière petite question, ça rejoint ce qu'on se disait, Jesùs. La France, par la loi du 2 août 2021, rapproche la médecine du travail et la médecine...
And a final question. We have a law from the 2nd of August 2021, and vocational medicine is closer to normal general practice. What do you do at an EU level? Well, at a European level, we're doing our best so that vocational medicine contributes to the improvement of health in general. We've not reached any concrete result yet, but in France you have a long-standing tradition. We're trying to learn from these types of best experience. Thank you, both of you, for this EU view and community view. Now, I think the time has come to conclude our debates.